Hi, my name is Dr. Sean Adibi and I'm an Associate Professor in the Department of General Practice and Dental Public Health, School of Dentistry at Houston. I prepared this presentation to review dental diagnostic system previously known as Easy Code for use in electronic health record. Thank you for taking this course, and I hope it will provide you with valuable information that you could use in your everyday practice. Please read the disclaimer presented here. Please read the disclosure provided here. You may take as many breaks as needed during viewing the video streaming. Simply pause the video and return when you're ready. After viewing this presentation, you'll be required to take a brief examination to verify successful completion of the course and receive education credit. This module presents soft and hard tissue interest lesions and conditions present to practitioners that require identification of these common lesions of interest and necessitates selection of a diagnosis using dental diagnostic system. The presentation is compiled of case studies and provides information with clinical photos or radiograph and is shown simply for the purpose of selected subject matter. Upon completion of this course or module, the participant should be able to understand important and purposes of using dental diagnostic system, identify common encountered clinical lesion of interest, select an appropriate diagnosis for selected cases, evaluate what's learned in this module. Dr. Kalandarian and colleagues define dental diagnostic system as a common terminology describing diagnosis, including empowering dentists to document the types and frequencies of condition they encounter, enhancing communication with patients and other clinicians, enabling outcomes tracking, and facilitating data sharing across sites. Let us explore and discuss what the dental diagnostic system is. Simply, we can summarize that the Dental Diagnostic System 2014, formerly known as the Easy Codes, consists of 1,529 terms organized into 106 subcategories and 17 major headings. It provides common and consistent language specifically created for and applicable to the field of dentistry, related specifically to diagnosis, and contains concepts at the appropriate granularity required for oral health providers. Why use a dental diagnostic terminology? For clinicians, consistent use of a dental diagnostic terminology will empower them to be able to document the types and frequency of a condition they encounter, enhance communication between them and other clinicians, thereby enabling outcomes tracking and data sharing across sites, allow quick access to review patient conditions and identify unclear areas, enhance consistent documentation and communication between the dentist and his or her patient. For epidemiologists and researchers, use of dental diagnostic terminology will allow the ability to evaluate disease pattern and outcomes of oral health, afford the opportunity to assess in-depth variation in oral healthcare quality, cost of the care, and treatment effectiveness or outcomes. Study disease trend over the time, make prediction and recommendations, design prevention and palliative interventions where necessary. For students, consistent use of a dental diagnostic terminology will help hone their diagnostic skills. Studies have also shown that arriving at a diagnosis before planning a treatment significantly increases the quality of the treatment plan and ultimately patient care. Help structure a systematic approach to rendering dental treatment to patients. Allow for intelligent discussions of diagnosed dental conditions, study trends, and gain insight into effectiveness of different treatment outcomes based on similar diagnosis. For administratives and top executive officers, it will be an essential quality improvement tool measures. It will be useful in making informed decisions and policy strategies, in sponsoring preventive oral health care campaign, making recommendations of a better clinical practice when treatment outcome failures are rising or reducing. For patients, it will facilitate self-learning of their conditions and disease, facilitate communication with their dentist and specialty providers, facilitates communication with their primary care physician regarding their dental and oral health conditions, augment relationship between referring providers, thereby minimizing errors. Now that we know many reasons for using dental diagnostic system, let's summarize several benefits of using the dental diagnostic system. As a standardized terminology, the dental diagnostic system allows oral health and other healthcare professionals to communicate effectively and accurately. The dental diagnostic system helps students in honing their formal diagnostic skills, emphasizing the link between diagnosis and treatment, and thus enhancing patient care. There is an increasing focus on evidence-based dentistry in clinical practice today, but little usable information to base that evidence on. consistent use of a common diagnostic language to code information in patient records provides an improved information base to support outcome analysis. Standardized patient documentation and enhanced communication between caregiver may result in improved patient safety and improved quality of care. By integrating a standardized terminology into healthcare information technology infrastructures, system-wide data could assist with public health monitoring by providing dental healthcare information on a regional, provincial, or national basis, identifying the area of higher disease prevalence and incidence across the country. A standardized terminology can support quality audit in performance of an institution. Clinical administration effort and overall cost of healthcare will be reduced with a standardized terminology as it enhances communication into multidisciplinary care and minimizes duplicate data entries. The following are a list of the main categories of DDS terminology. Abnormality of teeth, caries or loss of tooth structure, endodontics, periodontics, anatomic abnormalities, oral pathology and oral radiology, pain or altered sensations, harmful oral habits, occlusal disorders, defective restoration, trauma and fractures, Temporomandibular Disorders, removable prosthodontics, aesthetics concerns, orthodontics, exam for tests for administrative or healthy, ICDAS or International Caries Detection and Assessment System. Please note that following cases are presented in here are only for the purpose of discussion on using dental diagnostic system. Let us select and explore at least one subcategory of each main category seen frequently and encountered in clinic with need for diagnosis provided by dental diagnostic system. Depending on your electronic health record version, you probably start with a page like this one. I've blocked all identifiable information here to comply with HIPAA regulations. Please click on Create a New Record tab where I have marked with the yellow arrow. Then you will have to select the dental treatment mode. To plan a procedure code, you most likely start with the code D0150, here with description of comprehensive oral evaluation. Then you will need to plan this procedure code by clicking the Plan tab with the yellow arrow pointed here. Here you will be prompted to select a diagnosis for your procedure planned. Clicking on Diagnosis button will open up the list of select clinical diagnosis for you. This window is where you must go after every selection of procedure code in order to select appropriate diagnosis. You will be able to switch in between each main category on the left and click the plus sign to expand each subcategory for more granularity in selections of diagnosis. Start of next slide, we will explore each main category and select a subcategory appropriate for that particular example case. Alternatively, if you wish, you can explore by typing in criteria that you think is your probable diagnosis, as I typed as caries recurrent, and see what is available to choose in this particular subcategory. As you see here, abnormalities of teeth have several subcategories such as cementum defect, dental defect, enamel defect, eruption abnormality, number alterations, pulp abnormality, shape alteration, size alteration. This 19 years old female patient presented to our clinic with chief complaint of "I need crowns." Normal enamel thickness, but occasionally affected area evident. After evaluation of a patient past and present medical and dental history, a diagnosis of aналмогенезис imperfecta determined. Caries and tooth structures consist of several subcategories such as caries, loss of tooth structure, and caries risk. This 32 years old Hispanic female patient presented with chief complaint of "I have sensitivity on some of my teeth while I chew sweet foods." Both radiographic and clinical examination revealed no definitive signs of a caries to dentin. Therefore, a diagnosis of incipient caries in enamel unknown depth was selected. Endodontics category has several subcategories such as pulp diagnosis, secondary pulp conditions, and periapical diagnosis and root fractures. This 27 years old female patient presented with pain symptoms with drinking hot and cold, and on clinical examination exhibited tender to percussion to tooth number 19. After thorough medical and dental evaluation, diagnosis determined to be irreversible pulpitis of a tooth number 19. Periodontics category consists of several subcategories such as periodontal health, gingival diseases, chronic periodontitis, aggressive periodontitis, periodontitis as a manifestation of systemic disease, nectarizing periodontitis, abscesses of periodontium, developed and acquired deformities and conditions, deposit on or staining of teeth, and others. This 54 years old African American patient presented with chief complaint of my teeth are loose and I want to see what can be done about it. Medical history for this patient was contributory to hypertension, diabetes, with dental history of several past extractions. After complete periodontal charting and evaluation of her dental conditions, it was evident patient had bleeding upon probing in generalized area, several mobile teeth of both arches, many teeth with unfavorable crown to root ratios, and clinical attachment loss of greater than 6 mm on many teeth, along with probing depth ranges of a 5 to 10 mm all throughout the dentition. Therefore, the diagnosis of a generalized severe chronic periodontitis selected. Anatomic abnormalities have two subcategories of importance as hard tissue abnormality and soft tissue abnormality. This 35 years old male Caucasian patient presented with chief complaint of I have bad taste in my mouth. It may cause no symptoms other than sensitivity to hot and spicy foods. About 5% of the general population in the United States may have this benign condition. However, fissure tongues are associated with other conditions such as geographical tongue, also known as benign migratory glossitis, or syndromes such as Melkerson-Rosenthal syndrome, a rare condition. It not only causes a fissure tongue, but also lip and facial swelling and paralysis in the face known as Bell's palsy that may come and go. Fissure tongue occur in as many as 80% of the children with chromosomal disorder, Down syndrome. Once all these conditions are ruled out, only after thorough medical and history examination, we can choose diagnosis of fissure tongue. Oral pathology and oral radiology category have numerous subcategories listed as following: allergic reaction, benign non-odontogenic pathology, benign odontogenic pathology, buccal mucosal swelling, cyst of the oral origin, face swelling, floor of mouth swelling, genetic jaw disease, gingival swelling, inflammatory jaw lesion, lip swelling, malignant neoplasm, metabolic jaw disease, throat or neck swelling, oral or perioral pigmentations, other hard tissue lesion, other soft tissue enlargement, other surface lesions, palatal swelling, paranasal sinus pathology, red-blue lesion, salivary gland pathology, skin lesion, soft tissue calcification, sexually transmitted disease, systemic manifestation disease of jaw, tongue swelling pathology, ulcerative conditions, vertical papillary lesion, vesicular condition, and white-yellow lesion. This 25 years old Caucasian male patient presented with an asymptomatic radiopaque lesion during complete dental examination along with impactions of a premolar and several congenital missing teeth. Radiographical examination revealed unorganized impact odontogenic structures resembling enamel, dentin, and cementum, made the diagnosis of compound odontoma over the complex odontoma favorable. Additionally, history of a physical trauma to the area during the childhood age that could cause disruption during formation of teeth in the area gave additional hints for odontoma. The pain and altered sensation category consists of altered sensation, pain, and behavioral dentistry. This 55 years old Caucasian female patient presented with chief complaint of dry mouth that changed her ability to taste food and felt she occasionally had bad breath. Upon complete medical and clinical examination, patient exhibited complex medical history with taking several medications inducing dry mouth, including antidepressant, high blood pressure, diabetes, possibility of Sjogren's syndrome, a chronic autoimmune disease in which patients' white blood cells attack their moisture-producing glands. Several dental tests such as biopsy of a lower lip glands and salivary flow test, ophthalmologic Schirmer tests, and anti-rheumatic factor and anti-nuclear antibody test may be necessary to confirm a diagnosis of Sjogren's syndrome by a physician. In absence of other positive finding, most of her conditions were medication-induced, and the diagnosis of xerostoma was selected for this case. This 57-year-old male patient presents for comprehensive examination with chief complaint of I need to replace my lower right missing teeth. Head and neck examination along with full medical and dental exam revealed no other clinical findings other than the marked calcified mass in panoramic radiograph. Palpation of a neck and submandibular region of probable mass location was negative and painless to patient. Several differential diagnoses may be within the range of the conditions such as this one with a radiographic, asymptomatic, and incidental mass finding that located at the right angle of mandible. When searching for possible diagnosis in the list, you will note options such as above present selection of sialolith as one of your clinical diagnoses. The selection of sialolith would be most appropriate after ruling out all other possible pathologies consistent with this scenario. For instance, care should be given to not confuse these conditions with calcification of parotid lymph node seen frequently in patients with tuberculosis. If suspicious, sialography, ultrasound sonography, or other diagnostic imaging might be necessary to make the proper diagnosis. Since this lesion found incidentally and no inflammations or pain involved with this patient's condition, sialolith could be selected in this particular case. Additionally, degree of calcification was not palpable, and radiographic density is not to the level to call it stone, even though it might develop to become so in time. Sialolith, in this case, needs no treatment. It is important to mention that sialolith can develop within the ductal system of both mandibular Wharton duct system and the parotid via Stenson's ducts. However, it is more frequently seen in ductal system of submandibular glands. Once seen, you should advise patients to monitor this condition for possible future salivary stenosis, stone development, and or possible obstructions that might require intervention, especially when become symptomatic. This 25-year-old male presents with poor oral hygiene for complete dental examination. He has history of recreational drug use with the lack of normal salivary secretions. His chief complaint is, "I have infected tongue and I can't brush it off." Diagnosis of hairy tongue is consistent with the finding of this case. Hairy tongue is actually accumulations of keratin built up on filiform papillae of the tongue. Usually they start out in center and slightly anterior to circumvallate papillae on dorsal aspect of tongue and continue to extend over the time. They eventually pick up the stain from consumed food and they become either black, brown, or white color. Often, patients with extreme gag reflex will not be able to clean tongue well and are more prone to this benign and painless condition. Static and bad breath are major concern for these patients, and safest treatment option is vigorous scraping and desquamations tissue of the hyperkeratotic area. Harmful oral habits are subcategorizing on their own. This 45-year-old man presented to our clinic for checkup and an unrelated condition. After review of a medical and dental relevant information, during the comprehensive dental examination, this white spot of unknown to patient discovered. When questioned patients about it, he revealed that he had a sore tongue a week ago when woke up in the morning. In absence of other finding, patient was put on follow-up on this and reassured that he might have bit his tongue during sleep hours. He was recommended to see a sleep specialist to evaluate patient for sleep disorder, including sleep apnea. Until then, the diagnosis of tongue biting would be justified for this case. Occlusal disorders, subcategorized as malocclusion, teeth position, and jaw development. These examples illustrate the condition of a crowded teeth in anterior section of mandible as well as premaxillary area. Defective restorations category divided into two subcategories of defective restorations and defective implant. Diagnosis of defective restoration can be real tricky, and care should be given to examine radiographs as well as the clinical evaluations to confirm it. Examples presented here are rather very obvious ones. Often radiographs present with beam attenuations on the restoration to tooth interface. That makes restorations to tooth structures evaluation a bit challenging. Trauma and fracture category consists of tooth root fracture or structure trauma, fracture of maxilla, fracture of a mandible, and facial fracture. This 43-year-old African-American man presented in urgent care clinic with chief complaint of cracked tooth. After complete review of a medical and dental findings, it was discovered that tooth is non-vital and asymptomatic, otherwise with vertical fracture through two roots. Therefore, a diagnosis of vertical tooth fracture with pulp involvement selected for this case. This 54-year-old female patient present for comprehensive examination and evaluation with chief complaint of I have swelling on my gum area, persisted for about a year and I cannot get rid of it. After complete review of a medical and dental findings, it was discovered that tooth number 4 presented with periapical and mesial probable 3-valve bony pathological defect with probable incomplete obturated canals and vertical crown to root fracture. Since fracture appeared to be vertical in nature and no vital pulpal tissue remained in this case, diagnosis of vertical root fracture selected under the category of a trauma fracture and the subheading of a tooth root fracture. Recommendation for the best prognostic treatment for this case would be extraction of number 4 with curettage of preapical area to send off both tooth and associated curated tissue for biopsy. Restorative options after extractions for removable, fixed, implant, and or provisional restoration along with the bone augmentation to support treatment should be discussed. Temporomandibular disorders are divided to TMJ disc displacement, TMJ joint disease, masticatory muscle disorder, TMJ congenital development disorder, TMJ pain, TMJ mobility disorders, headaches, and others. This 50-year-old Vietnamese female presented in with chief complaint of pain in left temporomandibular joint with maxillary and mandibular maloccluded partial denture with history of several unsuccessful adjustments. Pain initiated during laughing or opening bite. Her dentist prescribed her nortriptyline 10 mg once a day, which is a tricyclic antidepressant for sleep, but did not help. Complete temporomandibular evaluation revealed moderate joint pain with cone beam computer tomography showing moderate flattening of the head of the left condyle. With consultation of referred oral surgeon to evaluate her future surgical options, a diagnosis of osteoarthritis of the left joint selected for this case. Removable prosthodontics divided to complete denture and removable partial denture. Case presented here is a common example of dentition that prognosis of maintaining remaining teeth are poor and at the best are unfavorable due to several medical, dental conditions and patient preferences. Therefore, when patients selected to receive extractions due to prosthodontic requirement, it would be appropriate to select the extraction required for prosthodontic reasons. Aesthetics concerns are made of subcategories of abnormalities of teeth, caries and loss of tooth structure, occlusal disorders, defective restoration, and removable prosthodontics. Occasionally, patient conditions such as this may require diagnosis that indicate as such. No matter orthodontics, prosthodontics, or implant therapy approaches is needed to restore patient aesthetic concerns, the selection of a diagnosis as missing teeth due to partial endodontia is appropriate for cases like this one. Orthodontic category consists of facial sagittal, facial vertical, facial transverse, skeletal sagittal, skeletal vertical, skeletal transverse, dental sagittal, dental vertical, dental transverse, dental parameter, dental functional, and other. This 24 years old male patient has an extra partially impacted tooth that is mainly due to dental parameter conditions in the mandible. Therefore, a diagnosis of supernumerary teeth would be appropriate for this case. This category is exam, test, administrative, health category that is divided to two subcategories of no term can be assigned and healthy. As you are well aware, there are times that no diagnostic terms can be assigned for a procedure at its early stage, or you must rule out pathology of a presented symptomology. This category designed for that purpose. When all other possibilities are ruled out, a healthy diagnosis can be selected. Another recent addition to dental diagnostic system is under the category of International Caries Detection and Assessment System as ICDAS. You may go to ICDAS Foundation website and get insight by clicking on a guide for practitioners and educators and review detailed for selection of ICDAS subcategory. It is important to remember that most clinical situations, as it was on previous cases presented, require list of differential diagnoses and final diagnoses as primary, secondary, tertiary, or even more. We focused here on primary diagnosis for the sake of simplifications. Current versions of electronic health records and treatment planning modules used in many systems accommodate multiple diagnoses selection for many given clinical scenarios. For instance, on below supernumerary tooth selected as primary diagnosis to address patient's chief complaint, and a secondary diagnosis of partial impactions of the lower right third molar can be considered. Additionally, a tertiary diagnosis of generalized wear of dentition is justifiable based on clinical findings. Oral pathology and radiology section is by far more numerous than any other categories in DDS. Below example demonstrate cyalolith of Stinson duct where yellow arrow is pointing as a common diagnostic finding with many patients. Missing tooth number 30, microdont of upper left partially impacted third molar, and amalgam tattoo distal to central incisor root apex are few of many other variations from normally seen and frequently. This case is a 20-year-old Hispanic female with unknown duration of having small brown papules on dorsal surface and tip of the tongue. This condition known as Papillary Tip Melanosis. This particular condition is a benign one that requires no treatment in absence of any other syndromes or systemic conditions. Many recently published and recognized lesions of pathologic interest, such as this one, published recently, and you may not find them in previous versions of DDS. I am hopeful as updates are made, new recently published and common conditions will be added to the future versions of DDS. I hope that now you have more insight on importance and purposes of using dental diagnostic system and able to identify common encountered clinical lesions of interest listed in this presentation and feel ease to select diagnosis in the future. Please make a note of the reference slide at the end of this presentation and explore additional learning opportunity with them. Please contact us with this email address below. Please see list of references for the purpose of this presentation. Thanks to Dr. Kalandarian and her colleagues for their great work in development of DDS, and many thanks to Dr. Muhammad Walji for his input and edits made for these presentations. This completes the module on overview of dental diagnostic system. It is time for you to take a short exam in order to complete the requirements for this video course. Due to the nature of the subject matter, passing score of 80% is necessary in order to receive credit in this course. After completion of the examination, you will receive a visual confirmation of successful completion. If you fail to answer enough questions correctly, you will be instructed to take the exam. A new set of questions will be provided. You will have 3 chances to satisfy this requirement. If you are not successful, you will be instructed to review this module again before your next attempt. Exam is next. Good luck with your exam if you're ready to take it.